Clinician's View offers curriculum modules for OT and PT programs easily incorporated into existing program curriculum. Each course includes full course previews for instructors and administrative access to students' progress. Practice exams are included for a more complete learning experience. Course modules include Cadaver Anatomy, Developmental Hand Function, Seating and Mobility, Treatment of Adult Hemiplegia, Treating Motor Disorganization and Learning Disabilities, Goniometry, and Joint Mobilization. Students pay only $45 each for full semester streaming access. Comprehensive texts, video discussion, and clinical treatment demonstrations for less than the cost of one textbook. Interactive cadaveric dissection.
Identify the triceps. Using forceps and probe, work loose the skin from the underlying fascia on the dorsum of the hand. Make a midline incision on the posterior thigh to the popliteal fossa area.
Pediatric seating and mobility.
And she only can go to here when all of a sudden I feel that pelvis going into a posterior tilt. What does that mean? I know that she seemed to have a pretty upright pelvis, and when yeah, you do like tigs. An anti-thrust seat is just that. It's providing a block so somebody doesn't thrust forward. So the way that you measure the anti-thrust seat is the first thing is the pelvis has to be upright. The last piece we did, if somebody has a tendency for a curve, we wanted to see how flexible that was, and we get that through the rib cage.
A neuropostural approach to learning disabilities. The neuropostural treatment approach is based on NDT physical handling principles. To effect an efficient change in disorganized movement and posture, one must control, modify, and grade sensory input and shape, refine, and repeat functional motor output. The emphasis of physical handling is on providing the conditions necessary for the child to make an active, adaptive response. Physical handling inhibits inefficient reactions while facilitating proactive, adaptive responses that are activated by the child. Unlike sensory-based approaches that result in reactive responses through sensory stimulation, physical handling provides a postural base that helps the child become more efficient in motor control from an organized base of support. Joint mobilization.
Straight across here, anteromedial. You need to go parallel to the glenoid fossa, which is at an angle. Okay, so the mobility is in there, and you can actually feel this one with no problem. And then to show it on this side. Let's think about this for a minute. We've just named many reasons why this dude's stretched out. So if the bones are not particularly congruent, which is true, and the ligaments are now all stretched out, which we just suggested, what's the next line of defense to protect a joint? Flexion. So you start there. Inferior glide, get your range. Inferior glide, get your range. Inferior glide, get your range. Okay. Do not do inferior glide and range at the same time. You'll break the femur. That's an inferior glide technique. Another way of doing it for the children who, let's say you can get them to about 90 degrees or so, but there's just no space for your leg and their tummies and their jeans and everything else in there. You need another way to get your inferior glide. Stabilize the pelvis and push the femur inferiorly from here. Why was that, right? Is to do it from here. Hang on to the ASIS, which is what I have here. Hypothenar eminence on the trochanter. Thenar eminence then falls on the head of the femur. And just relax. I'm going to go ahead and do CPR. Watch your foot. CPR for the hip. What I'm not doing is that, which does hurt, or this, which is her SI joint.
Goniometry.
Now we're going to do hip external and internal rotation. When you do hip internal external rotation, you want to make sure that you do not look at the foot. You want to look at the femur and see which way you're rotating here, okay? Okay, if we look at the femur here, when the femur rotates out, even though the foot comes in, this is called external rotation. This is internal rotation, okay? Do not get confused in regard to which way the foot goes. Forget about looking at the foot. Look at the femur and see which way it rotates. So if the femur rotates out, that's external rotation. Okay? If the femur rotates in, that's internal rotation. So don't even look at the foot because the foot will confuse you. Patella, and you're going to be right through there. And we are going to do external rotation. So what that means is I'm going to ask the patient to bring the foot across the body in that direction. The stationary arm is going to be perpendicular to the ground, okay? And the motion arm is going to follow the leg. Okay, so now we're going to do hip add and abduction. We'll do abduction first, where the leg is moving out. Hip adduction is when the leg moves across the body, okay? So the motion is happening here at the hip joint. Okay? When we measure the hip joint, we want to have the axis over the ASIS, okay? The motion arm is going to be in line with the femur, and the stationary arm is going to be in line with both ASIS, okay? So let's show you how that's going to look here. I'm going to test foot inversion, and the foot moves in. Some people call this inversion supination. Okay, and this is foot eversion, which is some people also call eversion pronation.
The treatment of adult hemiplegia.
I want to see what she does with that. A lot of your patients, as they start to do that, will do an awful lot of rotation here. You want them to stay still. So I'm going to try and keep her a little more active in her trunk rather than her arm. And do it again. That's better. You see how you have to use that left leg? Mm-hmm. Okay. So I place my finger pads on the shaft and around the head. And then the heel of the hand goes on the dorsum. My other hand is stabilizing the hand, and I've got a pressure on the head of the fifth metacarpal. I'm using a finger pad to hold the head of the fifth metacarpal. So now I'm going to spread her metacarpals. Now when I ask her to sit up, she really has to hold in her legs a lot. Now bring your foot out so that your knee heels underneath your knee, both sides. See, that's easier. Yeah. So you need to think about the foot placement. Where is it harder? Where is it easier? You might start with it here.
Developmental hand function and handwriting.
We want to pay particular attention to the fact that the extensor carpi ulnaris works synergistically with the thumb triad. Thumb triad being right here, where the three skill muscles of the triad are located. So this muscle is going to work synergistically with it. And it's going to do it by stabilizing the wrist when the thumb side or the radial side of the hand is used for skill. So we have this point of stability, this point of stability. And now we can have control, mobility, and motion here. What do our metacarpal joints? There are 3 degrees of freedom. And a degree of freedom is what is the movement pattern? Okay, so first degree, flexion, extension. Why would a child develop this type of grip? To get stability. Okay? But what happens, then the pencil is stabilized distally, and he has to go proximally for mobility or to move it around. Not a good situation. If you are working with older children, they're good at math, they're good at spelling, they're good at all of this. They can't write. This is generally the problem right here. Carpal metacarpal, that saddle joint. And what you say to them is, take your thumbs and make L's with your thumbs. And they do this. The problem is you can only stabilize your thumb in full abduction and full adduction. If you try to stabilize your thumb in between, the extrinsics can't come in and help to stabilize here. Okay, so what you have to do is you have to mobilize or stretch out so that you can get these L's. You can get full abduction so that you come around. Having on the writing line, I'm going to say to my hand, climb over the clock to 1 and stop. Do you see this bell up here? That means when you get there, you're going to stop abruptly.
Clinician's View, University and College Curriculum Modules.